Before we begin, all of us at the Medical Society Consortium on Climate and Health respectfully acknowledge that our advocacy, education, and learning across the country takes place in the occupied and unceded lands of many Native American tribes. To acknowledge this land is to recognize its long history and our place in that history. It is to recognize these lands and waters and their significance for the peoples who lived and continue to live in this country, and whose practices and spiritualities were, are, and shall always be tied to the land and the water. Today's webinar is the fifth in our 2023 Climate Justice webinar series as part of the Climate and Health Equity Fellowship Program. The CHEF program recognizes the need for more diversity in climate and health leadership and a sharper focus on equitable climate solutions. The goal of the fellowship is to empower doctors of color from populations that face greater burdens from climate effects and are underrepresented in medicine to become leaders in climate and health equity, education, advocacy, and policy solutions. I'm Dr. Shanita Johnson, Deputy Climate and Health Equity Fellowship Director. Also joining me from the consortium to run this webinar is Program Manager Dr. Kimberly Williams. Dr. Williams will be available through the chat to answer any technical questions during the webinar. Our other team members on the webinar are Dr. Mark Mitchell, Chef Founder and Program Director, and Dr. Venice Curry, the Western Associate Director. The webinar series is hosted by the Medical Society Consortium on Climate and Health and is held for 1 hour on the second Friday of each month from 3 to 4 p.m. Eastern Time. Today's webinar will be recorded and made available on our website for future viewing as part of the Equity Resources page on the consortium's website. This year, we are pleased to offer CME credit for our webinars. Instructions on obtaining credit will be provided at the end of this webinar. Today, we are really honored to have Dr. Carlos Eduardo Martín, lecturer in real estate and project director, Remodeling Futures Program, Joint Center for Housing Studies at Harvard University Graduate School of Design. Rather than using our time to provide further description of his impressive work, we are placing a link to his bio in the chat. As a healthcare provider, it is important that you consider the role that healthcare systems and providers play in regard to climate and health. In this webinar, Dr. Martín will discuss innovative housing design, green housing, and disaster mitigation and recovery. He will also share some of his research and projects at the intersections of environmental and construction quality in housing with racial equity and income disparity, and touch on solutions. The general format for today's webinar will be a 30 to 35-minute presentation by our speaker, followed by 10 to 15 minutes of questions and answers from the audience. We ask that you put comments, links to any resources that you may recommend, or any questions that you may have for the presenter in the chat box anytime during this presentation. We will get to as many of your questions as we can during the Q&A period. Please do remember to keep yourself muted so we are not interrupted by background noise. Dr. Martín, we are ready for you to please begin.
Thank you so much, Shanita. It's a real pleasure to be speaking to all of you, especially knowing what this fellowship means to so many of us and what it can mean to the future of health providers in this country. So I'm very grateful for that. I'm joining you not from where I work, but from Southern California. I do want to know I'm in Moreno Valley, so historical land of the Cahuilla Indians, of the Awakalims and Cabazon tribes. And so with that, I'm grateful that you did not go into a huge bio about me, because it's always embarrassing and it's always a little annoying to the listener because everybody could look up their bio. So thank you for that. The only thing I do want to say isn't so much about me. It's sort of about how I got to where I am and my interests as an architect and engineer. I mean, as a kid, I was always interested in housing, in where houses were, what they looked like, how they performed, and how different members of my family had different access to different kinds of housing resources. So I'm Chicano Mexican-American from California originally, so it's nice to be back at home, but I now live in Boston, in the Boston area in Massachusetts. And so that interest the physical quality of our housing is what always interested in me. And now the primary issue that concerns me about the physical quality of our housing is in response to climate change's effects, as well as how housing is a vehicle for potentially mitigating future climate change. So these are always the issues that I've thought about. I will be discussing some terms. I'm going to make this a little bit of a lecture, so feel free to tune out if you already are very familiar with these terms. But knowing that this is primarily a health provider and medical group, I just want to make sure that some of the things I'm saying are clear and defined. So the 6 terms, I'm going to limit it to 6 terms. 2 of them should be well known by everybody. So climate mitigation versus climate adaptation. And when I say those 2 terms, so climate mitigation is basically everything we can do to stop preventing future climate change. And this has to deal with our energy use and our reliance on the fossil fuels that have created climate change and how we can reduce that. So we'll talk about that because there are very clear health implications, particularly around that transition to non-fossil fuel burning environments. I will also talk about climate adaptation. So climate adaptation was originally, interestingly enough, among the environmental community, was something that people didn't want to talk about because they said, well, let's fix the problem. Let's stop causing more climate change effects. And let's not spend money and resources on how do we respond to the climate change effects that we're already facing. Well, the reality is we're facing the effects. So I'm going to switch the order. I'm going to talk about climate adaptation first. And in that sense, I want you to think about all of the ways in which housing and our physical community environments are part of the health system that have health outcomes. And I'll talk a little bit about sort of the relationship that I see in housing and the health outputs and outcomes that you all are witnessing. So let me share my screen. And hopefully we all can confirm that you all can see it.
Yes, we can.
All right, thank you. Thank you. I heard it from the choir. Thank you very much. So part of, and of course, disclosure, I have no financial interest in any manufacturers of commercial products or anything related to this activity or the health community whatsoever. So I will talk about some of the work I've done with academic groups in the health community, but that's not a disclosure induced requirement. So I said I was going to talk first about climate adaptation. So I want to switch this order because we have to acknowledge not only the people who come before us on the territories that we occupy, the lands that we occupy, but all of our brothers and sisters who are suffering at this moment in Hawaii from the wildfires, all of the people that are suffering across the country from major heat waves that are slow deaths that are killing so many of our communities. So we have these larger events that such as the Lahaina wildfires, as well as these smaller incidents that are both of which are becoming more frequent and more severe over time. I mean, I think we're up to just the last time I checked this morning, 55 deaths in Hawaii. So let's give them our thoughts as we proceed with this conversation. And that's why I wanted to talk about this first, because there is a very clear, mortality implications, but also these longer term heat manifestations that I think we need to be focusing on a little bit more. I'm sure everywhere in the country that you all are in, there's some manifestation this summer of how that is playing out. So here are the 4 other terms of the 6 terms. So we talked about climate mitigation and adaptation. We'll talk about adaptation right now. But for each of those, mitigation and adaptation, there are 4 things I want you to consider. One is exposure. So that's just the environmental hazard and its likelihood of occurring at a certain place. We could say that it's neutral of wherever community it hits, but the reality is that clearly fossil fuel industry has helped create climate change, that there are certain places that have more exposures to certain kinds of effects, but the whole planet is going to be experiencing a climate effect. I'm going to go on a tangent right now. My favorite call, I get reporter questions all the time. And they always say, well, where should I live in this country if I don't want to experience climate change effects? And I say Mars, because the reality is what we've done on this planet is having massive effects. And we see that most recently, most frequently, and sort of frontline communities on the Gulf Coast and also in Alaska. But there's no place in this country that's going to be immune to the effects of climate change. So exposure is going to be the first thing I talk about. Second is vulnerability. So these are the things, the social, economic, political context in which individuals and individual communities experience, which are obviously informed by long-term history, historical conditions such as racism and income disparity. So exposure is different from vulnerability, and I'll get into that a little bit more. When you think about how exposures and vulnerabilities play out, you realize that it's very place-based. These are very unique things. We can't make blanket judgments on any community. And I think that happens a lot when we're talking about vulnerability. We assume vulnerable communities are vulnerable everywhere in the same way. And while they may be vulnerable everywhere, they are not vulnerable in the exact same ways. And so it's particularly in relationship to climate effects. So I want to talk about that. Now, lastly, when we look at those places, then we see the inequities that occur and inequities that are perpetuated by our policies. So, okay. So now that I've gone through all those 6 terms, let's get into it. So climate adaptation, unfortunately in this country, our policies around climate adaptation are all disaster focused. Our focus has always been on the crisis moment and responding to the crisis. Many of you probably know this image. This is New Orleans after Hurricane Katrina. Certainly at 2005, the extent of the mortality, 800 deaths that occurred, long-standing physical and medical conditions that occurred well after this, including mental health challenges, and just the losses to properties, $125 billion in property damages. That also, when one has financial crises, also create additional mental health challenges and trauma, as well as physical vulnerabilities, such as not being able to afford healthcare, et cetera. So Katrina was a defining moment in our climate adaptation world, because it was that point when we realized that we have poor response and recovery that clearly benefits certain income and racial communities, namely wealthier white communities. This was an unprecedented exposure. So I mentioned exposures before. This is among a series of increasingly larger scale hazard events. This was the one that really, I think, punctuated American attention to the fact that this is real, that's happening more frequently. We're going to see more events like this, that our current infrastructure, the physical defenses that we think we have from these, are incapable of dealing with. So poor response and recovery, unprecedented exposures, ailing U.S. infrastructure, and probably first and foremost, the apparent racial and wealth inequities and disparities that we saw in treatments just in the crisis effect. Not to mention all of the vulnerabilities that preceded, that existed before Katrina even hit. So this was a defining moment. And it was clearly defining for New Orleans, right? We saw demographic changes occurring and continuing to occur in New Orleans as a consequence of that, and massive investments in new infrastructure that we believe will protect us from the next incident. These big events are really important. I think it's always critical for you, particularly as health providers, to think about how we can mitigate the challenges that occur in these big events, because they will be more frequent and more severe, and we have more people living in an urban population, so the density, the number of people, the amount of damage is going to increase as well. But there's also this smaller scale events that worry me just as much as somebody who works in housing and works in climate. The image that you see, unfortunately, is from this past year from Rolling Fork, Mississippi, where 22 people died from the tornadoes that passed through there. And Rolling Fork was predominantly African-American community. These smaller scale tensions, Rolling Fork was fortunate enough to get a presidential disaster declaration, so there are resources going towards Rolling Fork. But these smaller scale events don't get the same kind of attention as the big disasters. And that's not to say that we should not be providing resources and assistance in the largest scale disasters. We absolutely must. But the kinds of climate change effects that we're going to see aren't just those big events, and our policies are framed around those big events and disaster recovery. But these smaller scale events, such as sea level rise that will slowly take away land, that's already happening in Louisiana, at the rate of several football fields a day to chronic heat exposures, like these smaller, these more chronic events, I think, are what our policies aren't really framed for, but where we're going to see even more disparities. So I'm a houser. I come from this, again, from the experiences of the physical qualities of our communities and who lives in what kind of housing. So when I think about this, I think, well, who is going to be exposed? What kind of housing and where is it located that will be exposed to different effects? In my current home of Boston, Massachusetts, we already know that there are about 19,000 properties that are at risk just in the city of Boston and just from floods, from potential flooding exposure. So that's just one of the many. I'd say there are about 15, 16 climate change effects, physical effects, such as increased heat, increased wildfire exposure, et cetera. Flooding, increased due to sea level rise and potentially due to storm surge from large hurricanes and weather events, is just one effect. So 19,000 properties, that's just right now. By 2050, about 28,000 properties will be at risk in the city of Boston alone. So that's about 1/10 of Boston's housing. And that's just from flood risk. So these exposures are for what keep a lot of us up at night, right? There's what we think right now is a safe environment in which we live in. Particularly if you're a homeowner, you think you have some asset value. You have some protection, but the reality is there's a lot of exposures that we're just beginning to uncover, that the science, the hydrological, the climatological scientists are starting to depict much more accurately. So this is always what freaks me out. And again, that was just to flood risk, and flood risk would be considered one of these more extreme disaster-related events. When we talk about heat, there's an even wider scale. And these are the sort of the chronic effects I want you to keep remembering. Colleagues at the First Street Foundation just came out with a study this past year on extreme heat exposures and how that's projected to increase in the future. Just using the National Weather Service term of extreme dangerous heat, that's being in 125 Fahrenheit plus temperatures, which is, there are several populations who particularly elderly and young, who cannot survive in those conditions, right? Your body starts physically changing. You all know this better than I do. Just right now in the United States, about 8 million people are exposed to that kind of extreme danger at any point in a year. And by 2053, 107 million people will be exposed to this extreme danger. We're seeing this summer, right? Many of us live in communities that the temperature, it's been unprecedented where we've seen this. In many communities, particularly in Florida, most of the Gulf Coast area, Texas, Louisiana, Mississippi, Alabama, Florida, there will be days above 120 degrees that last the entire summer, if not up to 4 to 5 months of the year. What's interesting is that people assume it's the southern parts, right? The Southwest, the Southeast that will experience these. But the biggest change that we're going to see is actually in the Midwest. There's a line from Louisiana all the way up through Illinois, in which those numbers of days that you're exposed to higher temperatures is going to increase. And those are communities that haven't really prepared at all for this kind of challenges. So what happens from that? So I just talked about exposures, the variability of exposures. Let me talk a little bit more about the vulnerabilities. So again, these are the social, the economic, the health, the political disparities that pre-exist the hazard. And then the hazard comes and the hazard makes things worse. So a study I did with colleagues at the Urban Institute, we looked at financial outcomes from different kinds of disasters. And we looked at a frame of 4 years of different kinds of disasters because we could get credit score data. So we were able to track credit scores classified as poor, fair, or good. And unfortunately, many of us know what these terms mean, but poor credit scores means below 649, below 650, down to 300. Fair is about 650 to 700, and then good is above 700 up to 850. So in different scenarios, the outcomes play out differently, right? So in all scenarios, everybody's hurt in some way financially because a disaster has come, whether you're wealthy or poor. You have some level of damage, you have some job loss, you have some inability to get to your job, you lose a car, you lose other kinds of possessions, you just can't pay your utility bills, or your utility bill keeps getting charged and you don't even have access to power or water. So all sorts of conditions decrease financial outcomes after disaster. But when we look at these different size disasters, we have even more stark differences. So in the Hurricane Sandy example, we saw that people with good credit scores did go from they lost about 2.5 credit point scores on average, down to about 7 points by the 4th year. So another point I want to make sure I'm making clear is that this is the years by the 4th year. So your financial status actually continues to decline well after a disaster event. And 4 years was just the extent of our data. It's very possible that that spiral gets even worse. So let me flip over. And on that same Hurricane Sandy, you see that people with poor credit scores actually did comparably similar to people with the good credit scores in terms of their decline and their rate of decline. Part of the reason that this happened is because in these big disasters, again, that's where you get the big national attention, you get a lot of charitable donation, but you also get all of the additional federal resources, because unfortunately, our federal policy is still thinks that these events are special, unique, that they're these crises moments, they're emergencies that don't happen all the time. Just experiencing the summer, we know these things happen all the time. So we in most cases, those additional resources don't come into play. So people in the medium-sized disasters have even starker outcomes because they don't get this backup of additional home rebuilding funds, healthcare funds, et cetera, in the long term. So let me just give you the numbers on that right side, the medium-sized disasters. So for the good credit score holding people, that's good before the disasters happen. They have a short-term downfall by 4 credit points. And by the 4th year, it's down by about 8 points. So it's deeper than what happened in Hurricane Sandy, which shows that there is this effect that the additional assistance helps. But for the low credit score folks, you'll see that that was a much starker difference. It's down to about 29% decline in credit scores. And these, even minor changes in credit scores, can have major effects on people's access to any kind of credit, people's access to rental apartments, to any kind of purchases. So there are major effects that even just these slight differences that occur. Okay, so again, what I'm talking about here are the vulnerabilities, these things like our financial status before a disaster happens that affect, that play out massively afterwards. The EPA about a year and a half ago released this report about what they think of as vulnerability, comparing vulnerabilities and exposures. So this is different kinds of populations with different vulnerability characteristics in response to these different kinds of exposures. So the two I'm showing you are on the left are the low income, on the right are what they define as a minority. And this was pretty much all people of color, non-Hispanic, Asian, African-American, and Hispanic population. Excuse me. So let me draw your attention to the bottom 2 rows of what we see here. So you see for low-income communities, their coastal flooding property loss, their likelihood of experiencing coastal flooding property loss from a 2-degree global warming change is 16%. They're going to be more likely to lose coastal properties. So poor people are going to lose properties more at a 16% higher rate. With 4 degrees, it's about 15% compared to everybody else. But if you look at the minority side of the picture, you see that with 2-degree warming, there's actually less of a likelihood of coastal flooding property losses. It's -4. And but with a 4-degree global warming loss, it's about 49% more likelihood of people of color having coastal flooding property losses. So the reason why I'm showing you this is these are national level aggregate statistics, and they do not depict what happens at the very local scale when it comes to exposures and vulnerabilities. So if we look at minority households with just a 50 centimeter sea level rise, right, from the 2-degree global warming, the assumption that they're actually going to be safer than their white counterparts, whereas with 4-degree global warming with a commensurate 100 centimeter sea level rise, they're going to be much worse than their white counterparts. So when we're talking about sea level rise with people of color, we're also including Native communities and Latino communities in the Southwest that won't have the same kind of flood exposures as, for example, Black communities in the Southeast. So this is playing out very, very widely. So I'm always very careful to make sure that when we talk about these things, we talk about the place-based exposures and vulnerabilities. For example, one of the communities, since I live in Boston, one of the communities that I'm always concerned about are the assisted housing. So affordable assisted housing that exists in the country. So this is comparable. Remember that last chart that I showed you all before about the number of overall properties that are going to be lost now and by 2050 in the city of Boston. Well, when we look just at the assisted housing stock, and this is this slide is from my colleagues at Climate Central and National Housing Trust. Disclosure, I am on the board of the National Housing Trust, and I advised and reviewed this project. When we counted how many of those assisted housing units within that bigger number of properties, we found that by 2050, about 13,000 properties are going to be lost within the greater Boston area. So 13,000 is about 1/4 of all affordable assisted housing units in the Boston area. So these are the scales. So if I talked before about 1/10 of the properties are going to be lost in Boston by 2050. For low income people who live in assisted housing, 1/4 of those assisted units are going to be gone. So there's a disparity that's occurring here that's very place-based specific because of the local climate exposures, but also because of the histories of low-income people and people of color being segregated through redlining, through the range of different interventions that have occurred that have kept people of color in certain places in our segregated communities, in certain kinds of communities. I'm always conscious, like we hear, and I'm happy to talk about this in Q&A, about climate gentrification, right? Well, the reality is in many cases, what could be called climate gentrification is not happening. It's playing out in very different ways. And where it is happening, it's just good old gentrification, right? It's not necessarily because rich white people want to move into places that are safer. It's because medium income white people can't afford the rich white people's neighborhoods anymore. This is, for example, what's happening in Miami-Dade, where people of color, primarily Black and Afro-Latino communities, live in inland communities because wealthy, the coastal communities, beachfront properties are highly valued. So wealthier people, which in Florida meant tends to mean white and white Latino communities moving into the coastal areas. So their movement inland is what's being called climate gentrification. When we look at a place like New Orleans, though, a lot of Black families lived on safer land, didn't live on safer land. It was actually the opposite, right? Where they had, since the French occupation of New Orleans, had been purposely left off to commute to places that can persistently witness flooding. So this is very place-based. So that was the third term I wanted to make sure, third concept that I wanted to make sure you understood, that exposure and vulnerability play out very different in different places. The fourth is issues of equity. The inequity is, I mentioned the fact that our federal policy is based on crisis management at the point of disaster and not preparations for what the disaster could be, including thinking about reparations for historical vulnerabilities that could alleviate some of the disparities that we see after a disaster. But there are a lot of other problems with our policies. Our policies are based on property. So money is allocated based on property damages and not on people's needs, on people's disparate different life conditions before the disaster. our policies are also based on precedent. So we only learn from the past, but we haven't incorporated into our federal policy how we can predict what will happen in the future from some of these conditions. And so the amount of investment that is placed into, again, relief, response, rebuilding, recovery, and not on mitigation, and not on dealing with the historical inequities that existed before disaster, are what lead to these expanding amounts of funds having to go out after disaster happens. So let me give you an example. So this is a graph I did. It was part of the financial outcome study that I showed you before. Just so people understand, it's a spaghetti. If any of you have ever experienced a disaster scenario as a household, it's an awful experience. Not only what you've gone through, but then trying to get the assistance that you deserve and you're eligible for. So in the first couple of months after disaster happens, one must apply to FEMA individual assistance if it's declared by your governor and the president. And if that happened, you have about a month's time frame to get your application in. And that assistance at best it usually just is about for 2 months up to maybe 6 months. Rarely it goes up to about 18 months after the fact. So you see that fourth program assistance is FEMA individual assistance. That's what individuals can access. There are some other related ones like the transitional shelter assistance where you get a voucher for a hotel, that sort of thing. But it's a very short time frame in which you can get these. The last bar that you see at the bottom, HUD CDBG-DR, so that's Community Development Block Grants for Disaster Recovery for housing assistance. This doesn't really kick in until about, if you're lucky, 18 months after the fact. So that's if you're lucky. So that money has to be specially congressionally appropriated. So that's why it's shaded, because half the time it's not what happens. That's what you saw with the disparity between Hurricane Sandy and medium-sized disasters, that they didn't get that additional block of money and they didn't get that assistance. So those communities and those events, those small events are that much more disproportionately affected. So there's this valley of death that occurs. And that's only if they actually get the assistance, right? The long-term assistance. And that's where we just continue to see increasing disparities massively growing after a disaster effect. In many cases, people not only suffer financially and in terms of their health outcomes, as well as their employment access, they end up having to move. They leave, they transition to a local community. It's a whole life of emergency conditions in which they live that exceeds just a couple months after the event. We all know the famous adage that most households in the country don't have $400, for emergency effects. Well, the reality is if you're poor and if you're, in many of these cases, if you're a person of color living in places where you don't have the political capital and the social capital to be able to access resources, then you're in these positions where your vulnerability is going to clash with exposure and result in long-term inequality. All right. So I'm finally transitioning from adaptation. So I was talking about adaptation, all the things we have to do and are necessary after as an effect of the climate change that we're already experiencing. The best thing we can do, of course, to reduce future climate change's effects is to reduce future climate change. And that means climate mitigation. So I'm going to talk now about something that there is clear health implications from adaptation and the strategies that are being employed and what we need to do to deal with health exposures, et cetera, heat exposures, et cetera, excuse me. But climate mitigation is also an area near and dear to my heart because I worked in the energy efficiency world for quite some time, particularly as it relates to low-income housing. There's one area that I think we have some opportunity, especially given current funding from the Inflation Reduction Act and the Infrastructure Investment and Jobs Act to actually help not only reduce our reliance on fossil fuels that are causing climate change, but also focus on those communities that have been historically have not historically had the access to the energy positive interventions and the transportation positive interventions, et cetera, that we're seeing now. But let me give you some background on this. So right now, the U.S. total of CO2, which is primary greenhouse causing, climate change causing greenhouse gas emitter, is about 5 billion metric tons. And housing in our country accounts for about 926 billion of that. So housing is a big component of our greenhouse gases. And I'll explain a little through this chart what that means. But we're about 926 billion tons of our greenhouse gases are from our housing, which is the equivalent of between Brazil and Germany's total climate greenhouse gas emissions. So it's a big, just US homes in the United States, just on their own, are about the 5th or 6th biggest emitter on the planet. Okay. So how are we emitting that, right? It's not like most of us are like lighting up big old propane tanks. Some people still are lighting up propane tanks in their homes, but the vast majority of our greenhouse gases don't come from things like coal burning in our homes, which there were homes that burned coal up and through the 1930s, but from the electricity that we buy. So I do want to point out, of course, the orange line that you see in the middle right there, that's natural gas. So many, unfortunately, homes in the United States still rely on natural gas for their cooking, for their air systems, their HVAC, primarily heating, and their water heating. So I'm really excited to talk to all of you in your Q&A about the scandals that have occurred this past year about electrifying and not having a natural gas stove, particularly as health providers, because you know that natural gas burning in a house does have major health effects. But that, even though that is still a debate, and there's still a wide number of homes, I think it's 65% of homes that have natural gas for their cooking, for example, it's still this gray line that you see at below the total, like the green on the top is total, the one below that. It's where we buy our electricity. And most electrical production in this country is still fossil fuel based. We still burn coal and gas and petroleum to produce our electricity. So a lot of the policies that are created are structured around that, as well as electrifying our homes. So now that I've given you the bigger picture, I do want to compare this to what that means. So that end use energy consumed by residential sector is very different than the total energy consumed by the energy. So end use just means the amount of energy you're getting from directly in your house, right? So like I said, some of us do have that natural gas in our homes. Some of us live in all electric homes. I've been fortunate enough to be in one of those positions in the past 10 years of my life, but the vast majority of our energy is still coming from this electrical output. So I would call this sort of the exposure. If you're making the equivalent comparison with exposure, vulnerability, et cetera, this is the exposure, right? That we still have a lot of homes in this country that are using natural gas or other kinds of fossil fuels directly or by virtue of the electricity that they're purchasing. And there's also important to think about where that is coming from. So noted there, the 65% of homes are still using natural gas for their space heating. Another 26 are for their water heating. So there's a wide range, and these again are based on historical traditions in certain kinds of housing markets. For example, in Florida, I don't know if you're in Florida right now, the vast majority of homes are actually all electric. It's been quite a trend. So that's why it's always funny to hear people, Floridians including somebody who may be running for president, talking about, I should say, I work for institutions that are nonpartisan, so my views are my own. Okay, that's my one disclosure. That the reality is that most homes in Florida are all electric. So there really isn't this like natural gas, you're going to take my natural gas stove away from me over my dead body. Well, you don't have a natural gas stove anyway. So thinking about the histories of the construction traditions, the housing traditions that have led certain kinds of homes to have certain kinds of energy consumption is absolutely a critical side. That would be the place-based side that I want to talk about. Let me get back to the vulnerability issue. And this is the one that I'm actually actively concerned with. The reality is that there's still a major share of US households that are experiencing energy insecurity. So these are people who either can't pay their utility bills and are at threat of being getting shut off. These are people who take other measures, such as just not using their energy and being energy poor. In many cases, this leads to direct health outcome, right? I definitely recommend all of you read the work of my colleague, Dr. Diana Hernandez at Columbia University's Mailman School of Public Health, who looks at the behaviors that people take on when they can't afford their energy bills or are foregoing things like medicine, groceries, et cetera, to pay their energy bills. It's a shocking rate. Just using the REX data, and I want to be very conscious when I use this data, because the Residential Energy Consumption Survey from the Department of Energy Information Administration collected their sample for the current round of the REX data at the beginning of the pandemic. And at that point, a lot of states and a lot of especially counties and municipalities had moratoria on utility shutoffs. So this is undercounting actual energy insecurity in this country because people weren't losing their utility bills, and so they were less insecure than they would have been in normal times. Obviously, at the end of the pandemic, all of those moratoria went away, and so utility shutoffs are increasing immensely. So some of the story is kind of obvious, right? In the first, the dark brown, the dark purple bars at the top. Obviously, income is a big determinant of your ability to pay and experience energy insecurity. So the poorer that you are, the more likely you're going to experience an energy insecurity. This also plays out fascinatingly in by race. So American Indian, Alaska Native, and African American. I'm sorry that got dropped, but they at 52% rates of energy insecurity in those communities that have experienced any one of those kind of behaviors or have to take on any one of those conditions, compared to 20% rate for their white counterparts. Renters are at a disadvantage when it comes to this. So renters tend to be a little more lower income and be less at the and more at the mercy of their landlord and their energy, the quality of the housing that affects the energy consumption. This also plays out with multifamily, particularly small multifamily, and manufactured homes. So the range of vulnerabilities, and we could talk about these, that determine whether you are energy insecure. So the interventions that we're talking about right now, I'll go through these very quickly because I want to make sure we get into questions that have been proposed through things like the IRA, include increasing solar panels, right? Having community grids, having individual home solar panels, et cetera. The reality is only about 4% of all homes have solar panels right now, and there's certainly the need to increase that. But lower income communities and communities of color certainly disproportionately not having those. The next one is electrification. So that's making sure that you replace your homes, your heating with a heat pump, you have a new stove that's not that full electric, et cetera. Energy efficiency improvements are actually, I would argue, among the most critical thing to do, because there's a big push right now for electrification in many energy markets. Your electricity bill is more expensive than your gas bill. It changed a little during the last year because of the war in Ukraine, but so a lot of low-income people who are being told to electrify their homes are actually going to be increasing their energy bills. They're doing right by the planet, but they're going to be hurting in the short term. So thinking about those local markets, making sure that people, energy efficiency means reducing the amount of energy that you use, right? You have better insulation, better sealing of your exterior envelope in your windows, et cetera, so that you need less energy. So if you do electrify, you won't have to, your bill is still going to be lower because you're using a whole lot less anyway. And then there are other things like embodied energy. Yes. I'm sorry, I thought I heard somebody. I'm going to wrap up right now with, I'm going to go straight to digitalization. So this is the programmable thermostats that help manage your energy use. And again, as I monitor each of these different kinds of interventions and who has access to them, we see continued disparity by income and by race and ethnicity. So lower income households are much less likely to have a smart or internet connected thermostat than their wealthier counterparts. I'm going to wrap up just by talking about what I think is a core vulnerability in my world, which is housing. Housing quality. So I define this as a vulnerability mainly because the type of housing that we have is also a reflection of our racial history, our racist histories, I should say, and our income disparities in this country. So if you look at inadequacy, some of these, for many of us, this is not going to be a new story. It confirms what so many of our lived experiences are. Lower income people are more likely to live in severely or moderately inadequate housing than their wealthier counterparts. So you see that in the middle bar. Right now, on average in the US, about 5% of households live in inadequate, severely or moderately inadequate housing. Where people who make less than $10,000, it's about 10.5%. If you look at by race and ethnicity, we also see incredible disparities where American Indian and Black population have over 8% of those communities' households have severely or moderately inadequate housing compared to the white counterparts who have about 4% of moderately inadequate housing. And again, renters suffer disproportionately than owners. I had the pleasure of serving on the National Academy's Gulf Health and Resilience, if I'm getting the name correctly. One of the things, and I was the only non-health person in the group, but I'm a houser, and I know that housing is a platform for so many other social life outcomes. So we wanted to be sure that we not only talked about the outcomes of health in the Gulf. So we looked at, and said this is the far right bar in this causal chain, where we looked at mortality differences by race and income. We looked at healthcare access, et cetera, healthcare costs, all of the health outcomes that you all are probably more familiar with than I am. But then all the things that play a role in determining what those are. So that is like the cost of healthcare, the type of housing, which is my world. But then we also wanted to make sure that there are these underlying contextual causes and that underline my work, that underline the kind of work and outcomes that you're seeing as health providers. And these are histories of racism, wealth disparity, and then the access of public assistance, the undermining of local government programs that are designed to help communities of color and low-income communities. So this is hopefully a nice segue into questions around health and the connections with housing and climate. And I thank you for your time.
Great. Thank you so much, Dr. Martín, for such an enlightening presentation. Now we will take questions from the audience. And I remind you that you can type your questions into the chat box, and we'll get to as many of them as we can. We also ask that you please take a moment to fill out the webinar survey, and the link will be placed in the chat. Okay, let's see if we have any questions in the chat already. I can get started, Dr. Martín, with what do you think is the first change that we should advise our patients to make as they consider their personal and residential impact on the carbon footprint?
Great question. I mean, certainly there are things that people need to know about their house, right? Where the energy is coming from. If you have a gas stove, whether it's properly ventilated and things like that. I think my concern is always that we ask the household to know more than we hold the institutions accountable for knowing about their housing conditions. And so I would also say, what are the local building codes that have built this house? Things like that. It's absolutely important for us to make sure that institutional changes occur in addition to our ability to understand what our risks are. And a study that should be coming out from Urban Institute that I did on New Orleans, particularly around disaster climate adaptation. So what things people were doing to mitigate their own houses. We had to eliminate renters fairly early on from the study because renters and this is true of most of the country, are told nothing about their home. They're only told one thing, and that's the national lead-based paint requirement that everybody who's ever rented knows. They get a piece of paper. Hopefully they get this because it's a federal requirement. But in many places, renters aren't told anything else, right? If you're a homeowner ironically, still in Louisiana, you're given a wealth of information about your flood risks. But in many cases, particularly for first-time home buyers, for low-income home buyers, that's not explained to them. And if you're a first-time home buyer and a low-income home buyer, the stack of disclosures, property disclosures that you get when you're purchasing a home, the flood one is one of 80 other things that you're looking at, in addition to the, all the process of buying a home. So I'm always more concerned about holding institutions accountable.
Great. Do we have any questions in the chat, Kimberly?
We have a hand raised. No questions in the chat, but Dr. Cheryl Holder in Florida.
Hi, Dr. Holder. Great talk. Thank you. I'm curious about, as we move towards making some changes to mitigation, have they looked at things that we could put in homes to help us gather real-time data, like heat sensors or other, even indoor air quality monitors in different parts of the country that uses gas stove, that then can be fed into the health systems and do some warning and coordinating the housing with the hospital systems that serve those communities?
It's a brilliant idea, Ms. Holder. And I would say that, so many of us have proposed things. So I talked about programmable thermostats on purpose, because one of the things, I've had this pipe dream where we could have programmable thermostats that are fed into our health systems. So where there are elderly people or people of any kind of medical disadvantage or disability, would automatically notify hospitals or healthcare providers or the neighborhood groups, so that neighbors can check in on each other. Those things would also trigger federal or, municipal or county assistance for like bringing in a window unit AC, something like that. The reality is all of these systems are completely disconnected, right? So one individual's house and their housing condition can be completely separate, different from their neighbors, and nobody's really tracking what these things are. There are some good examples of emergency management folks trying to work in places like Miami-Dade in New Orleans, where they work with the landlords to know exactly who is in their properties, if there are any people with medical concerns or elderly people, so that they can evacuate them or give them appropriate shelter in place services. But the reality is those landlords who are willing to work with city governments are few and far between.
Yeah, I'm in Miami, and I can tell you, in terms of climate gentrification, why we say it here is that when you look at the areas that they've taken over and bought, they've not really put new investments in. So they move rapidly on areas that are low cost and also higher ground.
Yeah.
So it's beyond just that richer people and middle income can't afford it. It's really, they chose some areas to buy out very rapidly. Then they got the Army Corps of Engineers to make sure that those areas that they recently bought in even more protected. So there is an aspect of developers understanding the flood risk.
Yeah. So I certainly want to respond to that. I'm conscious that there are other questions in the queue. So I very much appreciate that. I think that the Miami-Dade, unfortunately, has suffered from intensive external investment in property. So a lot of foreign and other parts of the U.S., including equity funds, were buying properties over the last 2 decades in Miami-Dade. So now Florida, and I should disclose that I did give Mayor Libby Cava state of the city, the county's housing presentation last year. Florida now has the highest housing cost burden in the country, and this is for both renters and home buyers, because all of the exposures and all of the costs, for example, insurers leaving the state, have increased housing costs in addition to all of these people purchasing properties, but incomes still remain very low in Florida. I'm sorry, next question. I know there's another one queued up.
And this will be our last. We are short on time.
Sorry.
Okay. Katara Barola.
try to be quick. Let me also come on camera to introduce myself. Folks, I am actually in the occupied Ute, Cheyenne, Arapaho territory, or what's now called Denver, Colorado. That's where I'm calling from today. And just a bit of context for why I'm here. Actually, in 2021, I started what we now call the Environmental Justice Coalition here in Colorado. It's an entirely BIPOC coalition, all Latino, Indigenous, and Black folks in our coalition. We all fight for environmental justice in the state, specifically for disproportionately impacted communities of color and low-income communities as well. And one thing that we take into consideration, of course, is the cumulative impacts that our communities deal with. So it's not only, of course, extreme heat in homes, but that's compounded by our red line communities typically being near very polluted highways or streets, and then of course, very low soil quality as well as water quality. And so, forgive me, I actually chose to join the webinar because we are in the process of expanding our coalition, and there is an amazing Latina woman that is wanting to join our coalition, but her previous specialty was on housing in particular. She is now delving into environmental justice as well. And so we want to, of course, create a safe space for her to work alongside us. But I, of course, wanted to educate myself a little, as best as I could on, issues with housing in particular. And so kind of back to the background I was giving, just wondering from medical professionals and physicians here, if there are, I guess, any considerations for those cumulative impacts when it comes to testing and treating your patients, due to the illness that the different, I guess, forms of illness that they sometimes take or have to deal with. I'm just kind of wondering if there is anything taken in consideration to kind of help patients, especially patients of color that deal with those cumulative impacts. It's something we're seeing very, very greatly, not only in our coalition, but our state, and of course the work that we do. So I'm just wondering, yeah, if that's something that gets taken into account. And thank you so much for letting me be here today too.
Thank you. And I will certainly defer to my health colleagues in the health profession to answer the medical questions. But I should say that, I view housing justice as environmental justice. So I talk mainly about the physical quality of housings because I'm an engineer and architect by training, but certainly the location and the histories of those locations and exposures to a range of hazards, right, are big factors. So locational issues, land use issues, historical segregation. There's an interesting confluence of climate exposure with other environmental exposures, right? Which is why I brought up sort of Louisiana, particularly in Cancer Alley. Dr. Robert Bullard at Texas Southern always has that great phrase, you're the wrong complexion for protection, right? So it's a history of protection, not just from climate related hazards and hurricanes, sea level rise, et cetera, but also from a range of environmental exposures, because it's the underlying belief that we value property over people that has perpetuated a lot of these conditions and exposures to a range of bad hazards. So, and I apologize, I really went over time.
Thank you so much, Dr. Martín. We really could have this discussion go on much longer. I'd like to thank you and thank all of you for participating in our webinar series. I hope you found it useful. As a reminder, these webinars are every second Friday of the month. The next webinar is scheduled for September 8th, and the topic is transportation. Before you leave, please take a moment to complete the webinar survey if you haven't already. And again, the link is in the chat. And as announced at the start of the webinar, we are very pleased to offer CME for our webinars this year. To claim CME credit, please follow the link in the chat or scan the QR code on the screen and follow the directions on our website. Today's activity code to claim CME credit is 13054. Again, 13054. This now concludes our session. Have a wonderful day.